Hey, everybody.
Hello.
Can you hear me?
Yes.
Okay.
Okay. So, today we're going to interview Dr. Haneg and introduce him to some of the people that are following me. And I'm going to start with some questions, and we will go from there.
Hi, Dr. Haneg. You look cute
Hello,
today.
how are you?
Hi.
To see you again.
Good to see you too.
Thank you very much. So, could you tell me how we go? You will ask me questions and I will
Yes.
answer? Or... Okay,
Yes.
great.
Okay. I have my iPad here.
Okay. Are these
Okay.
questions came from your followers or?
Yes. Yes. Some of these are questions I've gotten from my followers, and I wanted to present them to you on live so that people could
Thank you. Okay.
hear directly from you.
Well,
You ready?
yeah, I'm ready.
Okay. So, hi everybody who's watching so far. Here I have Dr. Haneg. He is my rhinoplasty doctor. And I also had my friend Amalia on the live. She also got her rhinoplasty done by Dr. Haneg. And we're going to ask him some questions that my followers have been asking me in regard to my rhinoplasty journey. So, you ready?
I'm ready. Go.
Okay. So, Dr. Haneg, can you tell everyone your name and what type of surgeries you specialize in?
Hello, everybody. My name is Dr. Fatih Hanege. We are usually adding a E, Hanege. And I'm an ENT-based facial plastic surgeon based on in Istanbul. I'm usually doing facial surgeries, but about the last 5 years, I totally focused rhinoplasty. And especially my specialty is hard cases. I mean, thick skin patients, Asian patients, African, Afro-American, or Hispanic patients are really my profession about the last 5 years. Actually, I'm doing this job about 15 years. And just I'm focusing rhinoplasty because I'm doing this good. So I want to be, do what I do best in my life, in person, what I feel. So I'm focused rhinoplasty surgeries, especially ethnic rhinoplasties.
Okay, so you started doing facial surgeries, but you specialize in ethnic rhinoplasties. That's your passion. Okay. Question number 2. You already answered. It says, how long have you been doing rhinoplasties?
Actually, it's about 15 years.
15 years.
Yeah, and it's overall 15 years, but I'm really focused just rhinoplasty about 10 years maybe. I'm also an associated professor in Turkey, in Istanbul. I was an instructor in Istanbul Medeniyet University. I have too many students and also resident doctors. Now they are doing their job. I'm very happy for that. But about 5 years, I'm just doing this only private practice.
Okay, I see somebody wants to join Prime Vibes. Are you wanting to join because you want to ask the doctor questions? I'll wait for their response. Okay, the next question is, when you do rhinoplasty, what is the most important thing you focus on?
Actually, my main goal is to make really good-looking, attractive noses, but without changing everything. I mean, my patient need to be still the same person. I mean, a rhinoplasty surgery is not a surgery that changes everything. No, my main goal is to make some natural noses. But for me, natural noses means is not the same with before. Of course not. I will need to improve appearance. I need to make an attractive nose. I need to make it really beautiful, but still keeping the patient with the same person.
So essentially, you enjoy making people have natural noses with small enhancements, but still making sure that they look like themselves after surgery.
Actually, yeah.
Yes.
It is.
Okay. So my next question for you is, what makes your technique different from other doctors?
Actually, in Turkey, we have very intelligent colleagues. Everybody, we have too many patients, and Turkey is a center for aesthetic procedures. I think I have too many really good colleagues who's doing this well. Maybe for what make difference from the other doctors, behaviors. Maybe I really, take care of my patients. I really try to give the best service for my patients. My hospital is one of the best one in Istanbul. Also, my clinic is the same. My all staff who is interested with my patients, they are really treating like they're somebody is like from their family. And also I'm the same. I really, I like contact with my patients. I want to talk about they are in person. So first behaviors, and the second one, I don't like to make, for example, 3 or 4 surgery per day. No, because if a patient come to Turkey from US, from Australia or Europe, they need to be unique. And in that day, my all persons have one patient, a queen, or prince, and
Yes.
they need to feel like that, because I don't want to share my focus, my energy to 5 patients. No, I just do 1 surgery per day. But 2 is okay for me as well. We can share 2 in morning, 1 afternoon. So I don't have hurry. I don't have any, rush for surgery. I'm very patient. I'm really doing very patiently. And of course, during the surgery, always some troubles can be happen. But I think I know how to fix that during the surgery. I mean, if I have 5 surgery more after that surgery, then I need to feel a pressure. You need to be hurried because you have 4 surgery more. So I think my really revision rate is very, very low. I mean, I don't usually do a revision of my surgeries, because I'm finished. I'm finishing surgery when I feel that okay, I satisfy the result. I say okay, this is the best that I can do for my patients. I think this is the most important point for my success.
So what separates you from other surgical doctors' techniques is you only do 1 or 2 surgeries per day. So you don't overwork yourself, and you have more time to focus on each patient's needs. And then also your personality sets you aside and your bedside manners. And that's what makes your techniques different from other doctors.
Actually, of course, there are some other very technical things. I mean, I'm using always a rib cartilage for doing my surgery. I never, take a chance to graft is everything for the surgeries, because I'm usually working on thick skin patients. Asian patients are the same, Afro-Americans, Africans, I mean, or some Hispanic patients has very thick skin. And in thick skin patients, they need a really good grafting for supported the columella especially. And also if the dorsum is very low and I need to, add some good grafts on it. So maybe another reason is I'm really harvesting a rib cartilage as every day, and I know how to use it, how to slice it, how to, I know how to use it to get a good result.
Okay, so the surgical technique would be how you incorporate rib cartilage and how you place it properly per each patient.
Yeah, maybe.
Okay. The next question. What kind of difficult or complex noses are you most experienced with?
Actually, the most complex things are for us revisions.
Yes.
And I also like doing revisions as well. My most hardest case was a sixth revision of one of my patients. It was really hard, even dissection the skin. I mean, so it's a big challenge for me, and I like to fix that noses. But I want to mention something more. In revision cases, especially if it is like 5 or 6, there is no way it doesn't matter which surgeon do it. There is no way to have a perfection, because you are trying to fix the problems from previous surgeries, and they are usually, most of them are healing with a very bad scar tissue. So my main as a surgeon goal is to make an improvement and to fix the problems. So for extreme cases, it's very important to deal with the patients. I get that risk because too many surgeons cannot touch it, but I like really make an improvement. I like really satisfy when I see my patients are sometimes crying when they see their new noses. I really feel really good, but I need to be sure that my patients, they trust me, and I will do my best. But it will not be perfect. It will not be perfect as a primary cases. We will just make an improvement. We will make it better as possible as we can.
Okay, so you're saying that the most complex noses to work with are revisions, but you enjoy the challenge.
Yeah, I like the challenge.
Okay, so the next question, which I get this question a lot, how do you make sure the noses look natural and they're not overdone? Oftentimes, people will ask doctors for the Barbie nose, but how do you decide whether or not that patient is a good candidate for a Barbie nose, and how do you feel about Barbie noses?
Actually, Barbie noses, there are too many memes of Barbie noses. I mean, because it depends what they understand when we call Barbie noses. But as known, Barbie noses is short, very upturned, and super slim noses. They call Barbie nose for this. But actually, my style is not something like Barbie noses, because first of all, beginning of our live, I told that I'm an ENT-based and throat-based facial plastic surgeon. So function is really important for me, and a real Barbie nose, super slim, super short noses cannot be breathed well. So we can cause a breathing functional problem if we make it very slim, first of all. And then I learned that we need to respect the tissues. We need to respect the bone and the soft tissues. And if you force too much, tissue can be, make some troubles. So I don't like super slim noses. Actually, I don't like super slope noses, very upturned noses. So if the patient's expectation is very exaggerated, as like not only Barbie nose, I mean and I don't accept the surgery. I said, okay, this is not match with my technique. To maybe choose some other doctors. But I'm pretty sure that in 10 years, they will come for a revision for me. I mean, I don't think that this is not, the super slim noses, very, pointed tips are not in survive whole life. They will come for revisions, I think.
So essentially you're saying that Barbie noses are not part of your technique because you prefer to specialize in giving people more natural results.
Yeah, I mean, but of course, I respect when my patients want to have something like Barbie nose. I mean, of course, I'm making noses slimmer. Maybe you shared your before; it's maybe 2 times wider than now, but
Yes.
still your nose is very natural. Even I make it, very slim and upturn, very good looking, but still you look really. Before you were also beautiful. We cannot change. It's you. It's still
Yes.
you. But I make it slimmer. I make it upturn a bit and natural. But you really look.
But you kept the architecture of her face. It's like when you see a beautiful house.
Yeah.
Like for instance, they call them craftsman style houses. Well, what it means is it's original, and the original structure is really beautiful.
Yeah.
But then over time, you might want to improve it. So you make some changes here and there, but the overall structure of the house is still the same. And that's what you do, Dr. Hanege. You keep the overall structure of our faces intact. A lot of people think that Black people, I don't like to call this Black, I call this indigenous. But some people like to think that melanated and indigenous people want to slim down their noses because they want to look Anglo-Saxon, or they prefer to look more Caucasian. That is not the truth. That is not the truth at all. We all have very different reasons why we make this choice. Mine was more psychological because I dealt with some trauma, and I don't know. I don't want to speak for Natasha, but she can tell you her own reasons why she did it. But I can promise you neither one of us did it so that we could look Caucasian or white or whatever you want to call it. I love being a Black woman. And if I could do a little nip and tuck and a little critique here and there, that's what I'm going to do. And Dr. Hanege, you offer that up to all of us. As an ethnic rhinoplasty specialist, I just want to put it out there because, I'm a lot older than Natasha, and so I can understand where she is in her journey all the way up to where I am in mine. And we just happen to find a doctor that literally understands the ethnic featured face and respects it and doesn't try to change it, but more like enhance it. And so that's what I think. And you also stated that the Barbie nose, one of the reasons why you don't prefer to do it, you will, of course, within health reasons and your professional opinion, give people the noses that they want. But the Barbie nose is not a sustainable nose long term, is what you're saying. Is that correct, Dr. Hanege? It's just not, for health purposes, it's not a long-term sustainable nose, and it could cause health problems in the future.
I guess yes, but not at all. Of course, if the surgeon respect the tissues, the bone angles, and everything, it can be okay. But usually, for my technique, I don't believe that super slim noses, super shorted noses. Actually, we are talking maybe very technically, but there is some techniques in rhinoplasty we call tongue groove technique. That is usually the surgeon do as called at Barbie noses. The columella, they are fixing the columella to the septum, and that maneuver make the noses shorter and upturn. But the noses, especially the tip and the columella, is take very, very stiff whole their life, because that technique is making obtuse and short noses and also cause a very visible nostrils. That, I really scared to make a sorry for like piggy noses. I mean, because if you lift too much, then your nostrils will be very visible.
Dr. Hanege is so sweet. He said, I don't want to give you little piggy noses.
Yes.
I really, I'm sorry to pronouncing this, but
it's the
my
truth.
patients, but my patients are usually comes to me, and the most things that I heard, one is, don't make it piggy. I said, of course not. I mean, of course, I'm not. My technique is not like that. The other thing is, don't make my nose like Michael Jackson. I said, of course. I can understand why they scared, because everybody is coming to have a beautiful face, a beautiful nose, and I really respect that they scared to have something like that, because it's happening. It's happening, so I can understand what they feel. But especially for alar wings or alar base, I will come closer. Every country, I have maybe more than 50 countries. I had patients from more than 50 countries, and then after I do too many surgeries, thousands, maybe more than 5,000.
Wow.
I really know their anatomy. I really know how their angle is coming. So for alar-based resection, it's most wanted for my patient, especially African noses or some Asian patients. In my technique, I don't cut the base very from up of the noses, and I'm usually try to hide the incision in the groove, and also I'm creating any curve. It was like that before, and I'm making like that. I make it shorter, smaller, but still round. I don't want to make it triangular, because if you make it
I
very
hate that.
but the patients are asking because they saw some triangular noses after surgeries.
So a couple people asked in the comments if you can just give an idea. One person asked, do you do a bra lift? Another person asked, what is the average cost for surgery?
Actually, maybe it's better to, I have a coordinator, Rula. I really don't know how much or procedures, because we are providing hotels, rides, transfer. It's very complicated.
Yes.
I have really good crew. And my nurses, my coordinators, they know really better than me.
Yes.
I just focus the surgery. So maybe next time we can make Dula with, you can add it Rula, my coordinator. Maybe you can, they can ask prices to her.
Okay,
Yeah, that would be an interesting live. Yes.
Somebody asks, is this your nose doctor? Yes, everybody that's joining, this is the famous Dr. Hanege. I call him the nose god. And yes, he's my nose doctor. And for the person who asked about the price of a rhinoplasty, he has that managed by his surgery coordinator, Rula, and he did an amazing job. Thank you. We can host another live with him and his coordinator at a later time to answer those questions. We have a few more questions before we wrap up this live, because my doctor here has surgery in the morning and he has patients that he has to see. So we're going to move on to the last few questions. What should ethnic patients look for when choosing a surgeon? Someone at the bottom said, I went to Dr. Hanege in May. I'm healing beautiful. That's Britt.
Yeah, thank you, Britt. Can I? Could you ask again the question?
Yes. Okay. What should ethnic patients look for when choosing a surgeon in Turkey?
That's a good question because the most important thing is experience. My first ethnic rhinoplasty was like 10 years ago. A football player in Istanbul, in Turkey, he came to me for these surgeries. I just, of course, we know we are how to do it, but everything was, what book says I did. But the result was not perfect one. I mean, I'm talking about 10 years ago. Then I see that after in follow-ups, I didn't make enough projection because his skin was extremely thick. I tried to do it as like usually I do, but no. Then by years, I learned that in ethnic patients, especially columella, need to be supported very strong. If not, it goes down. And also I cut it because they're really complaining about how wide it was. So I cut too much, and I see that to make it smaller, but I see that I changed the shape. It's not anatomically fixed their faces. So the most important thing is experience. About last 4 years, my 90% of patients are ethnic patients. So I did more than 1,000 ethnic rhinoplasty. So for me right now, a Caucasian nose is harder than an ethnic nose right now. I mean,
I didn't know that. I always thought the Caucasian nose was easier for you.
Actually, when we see that in the list, because it is very rare, my patient is a Caucasian. I said, okay. I mean, because I'm very used to the ethnic rhinoplasty. So
Can I ask a question, Dr. Hanage? When you work, excuse me real quick, just before we go, I wanted to ask this. So that's a really amazing thing you just said about the difference between Caucasian rhinoplasties and ethnic rhinoplasties, because people automatically assume that people get rhinoplasties to have a white nose. But what would you say makes ethnic rhinoplasties easier? Is it because you have more room to work with? Is it because you have more, more volume to work with? What makes it easier?
Actually, I was talking about that. It's about experience, and for example, if you do something too oftenly, then you will be good in good skills in that kind of things. My kids were playing football, and they were really good, but we pushed them to the basketball, and every day they go to exercise basketball, and they do. But right now they don't play football good enough. I mean, they play basketball better. Even they have skills to make it to football player as a football. But so this is like that. I mean, my 90% of patients are ethnic. I mean, ethnic noses are hard to make. I mean, in Turkey, maybe we are not too much. Maybe 5 or 10 really good skilled surgeon has to do it. But after right now, I see that everybody is sharing some ethnic noses. They said, okay, I do it, but they are like my 10 years ago. I mean, their skill is the most important thing is experience.
Does every patient receive rib cartilage? Do you put rib cartilage in Caucasian? And what's the difference between using the implant and the rib cartilage?
I never, ever, all my life, use an implant without a cartilage. I mean, because I saw too many complications because of the implants. I know too many patients. I did too many revisions of Gore-Tex, silicones, and I saw too many complications. It comes off from the skin, and so I think our body is not accepting some, foreign tissues in the nose area. I mean, not of course, but in the nose, it's not looking anatomically good, and they're moving. They're, cause a symmetrical appearance, something. So I don't like implants. I always use grafts. I mean,
Yes.
and if you ask me about rib and implant, of course, rib. Um, do you know why we are using rib cartilage? First one, it is very strong and it's not, melting. It's really good. Sometimes we are using septum cartilage, but septum cartilage is so weak, or ear cartilage. I never use it because it is very weak. We cannot fix a nose, a thick skin nose, or in revisions or in ethnic noses. You cannot fix the problems with a very weak cartilage. So that I'm openly using rib cartilage. And I need to explain something. If our patients is over 40, 45, our ribs are ossificating by time because our cartilage are from starting the midline getting ossification. That means we cannot use their own rib. In that time, the patient need to, have a cadaver cartilage. We need to use a cadaver cartilage as a graft. The surgery success is the same. There are too many, published papers about this, and they all mention that there is no difference between the rib or the cadaver rib. So this is the other way to make it, to fix the noses, cadaver cartilage or the own rib cartilage.
Because Natasha, you have your own rib cartilage, and I have a cadaver cartilage, and I received the cadaver cartilage because of my age. Is that correct, Dr. Hanege?
Yeah, yes. Actually, you look very young. I mean, but your rib is aged.
Okay.
You are not aged. You are very young. You look really good. You're very young, but
Thank you, Dr.
Because of our age, our rib getting older.
Yeah, and because I think people, I've had a lot of questions about that, in passing. People ask me a lot of questions about my rhinoplasty, and a lot of them ask me, did I have my own rib cartilage or did I have a cadaver cartilage? And I said, no, I have a cadaver cartilage. And they immediately, I don't know why people cringe at that, because it's just bone. It's just bone, but it's also, I think, because I read up on it. Once you told me that I was going to receive a cadaver cartilage, I went and I did some research. And it's like you said, I may not look 56, but my bones are 56.
Yes.
And so it's for health wise, and this is what I adore about you, Dr. Hanege, you are always looking out for our health. And that was another reason why I chose you as a doctor. It wasn't just so I could get the nose that I want, which I did, and then some. It was because you were always cared about my health. I mean, to the point where I'll never forget, and I'll tell this to everybody, this is how amazing he is. I had some concerns about my nose, about the cadaver bone and everything. And Dr. Hanege stayed up till 10:30 p.m. his time in Turkey to talk to me at 9:30 a.m. my time here in California. So I will never, ever forget that. You are just the best doctor. And someone else was asking in the comments, did it hurt? And I said, not at all. And they were like none? Hey, Tasha, no pain.
Well, for you, I'm sorry. Go ahead, Amalia.
No, go ahead, babe. I was done. I was just tooting Dr. Hanege's horn.
I'd love to hear this. Thank you very much.
Okay, Amalia was saying, Conversation Sally, y'all see her. She's also in the chat. She was saying that she didn't have absolutely no pain. For her structure of her nose, they use a cadaver's rib, which would be essentially rib from donated from a dead person. And he didn't have to touch her rib, so she didn't have any pain at all during her surgery. As for me, Dr. Hanege used my own rib cartilage, which was right below my right breast. And my nose itself, I had no pain, but my rib, I had pain for a month. It just feels like somebody's punching you in your chest. But after a month, that pain goes away and the incision heals pretty quickly.
Yeah, it was the hardest part of my surgery. But it's not, you exaggerated, not 1 month, maybe 10 days after it will be better. The patients are usually 10 days.
So I know you have surgery in the morning, so there's just a couple more questions. All right, is that okay with you?
Yeah, I mean, it's almost 11:30 right now in Turkey. So
we're gonna wrap it up really quickly.
I can give you my word. We can make it later again. And maybe we can add also Rula, my coordinator.
Yes.
And she can answer for further information, and I can answer the medical questions.
Okay. So, before we go, is there any questions you want to ask me or Amalia?
Actually, both of you looks great, so I think everything is good in your follow-up.
Okay. Well, I really appreciate you for joining the live, and I look forward to us doing this again.
Of course. We will do it again.
Okay, thank you, and you have a great night, and have a good day in surgery tomorrow.
Thank you very much.
Bye.
Bye-bye. Bye-bye.
Bye. Bye, everybody.